but it's telling you everything that you're going to see.
Mm-hmm. The blood vessels
Okay.
is so clear.
How we're going to see. Why do I have shadowing here?
Is that the spinal?
Huh?
Diaphragm?
The what?
Diaphragm?
Nope.
Spinal? That's
My diaphragm's way above all this. Oh.
That's the spinal.
It's spine.
It's fine.
Spine.
Yeah, it's spine. Okay, so I have a story on that. So I had a sonographer come to me. He goes, Georgette, he goes, could you come and look at this? I think this lady has a tumor.
Mm.
I said, okay. So I went and I looked. I said, I don't see it. I said, you show me, and then I'll try to duplicate it. He was pressing so hard on her that he was looking at her spinal cord inside the spine. You don't have to push that hard. Okay? So here I have my aorta, my right renal artery going into the renal pelvis. I don't see my IVC because here's my IVC, okay? And so you can see the right renal vein going into, because the right renal artery is posterior to the IVC. Okay?
So this one, they have a good machine. They can see everything.
You can see everything with a bad machine too.
No, once he's showing the vessels, everything like that.
Okay. So now I've got my kidney, and they like to see color. Okay? Now, we can adjust the color. We can. Okay? Now, renal vein, the only way I would know the renal vein, okay, is to put Doppler on it. Okay? So, but if I tell the doctor this is my renal vein, he's going to believe it. Okay? So the renal artery is posterior, the renal vein is anterior. So I've got a pretty good guess going here, right? Okay? So, and your renal artery, the colors are more mosaic. Okay? They're not going to be mosaic in a vein. These are different velocities of the blood going into the kidney. This is a continuous velocity of the blood exiting the kidney. Okay? Blue is away from the transducer. Red is towards the transducer. And you can see here that it's mosaic. We can control that too, and we're going to show you how to do that. Okay? These you already know about. Dromedary hump. It's where you have more cortex that's going to be at the top of your kidney. The parenchymal defect, it looks like a bird's taking a bite out of the cortex. The column of Bertin, you have too much cortex in between the pyramids. Renal sinus lipomatosis, I haven't talked about that, or extrarenal pelvis. That is inside the kidney. It's not part of the ureter. So here we have a junctional defect, and you can see that it's a triangular defect out of a kidney.
That means they are coming near each other?
No, it's just one kidney. It's just that it's a defect that happened during embryology, and the cortex did not meet up with the cortex. You have a little bite out of the cortex. It's always a triangle. Column of Bertin, you can see there's too much space in between the pyramids. Do not measure it. Extrarenal pelvis. You can see that it's inside the kidney. Renal arteries, we've already talked about. Okay, renal arteries, renal vein. Here they talk about the nutcracker, where you have a vein in between two arteries. And where do we see that? A vein between two arteries.
Nephron syndrome.
Huh?
Nephron.
The SMA?
The SMA and the aorta. The SMA and the aorta.
And the renal vein comes between them, right?
Which one?
Here.
Left.
Left.
Yeah.
Left. Okay. Renal veins. If you have, this is a new thing for y'all, renal cell carcinoma is the most common cancer of the kidneys. My father passed away from it, and my husband's mother passed away from it. So it's very, very common. Okay? That's when we look at the renal veins, because it can travel up to the IVC. It can get a blood clot in the renal vein, and it travels up to the IVC and goes into the heart and kills you. Okay? Nephron, we've talked about that a lot. These are the parts of the nephron, the loop of Henle, talks about that a little bit. We've already talked about that. Here's some different pictures. See how the renal papilla is the end of the nephron. So from here it goes into the minor calyces, into the major calyces, into the pelvis, into the ureter. Okay, here it tells you about the afferent and the efferent. Where Sophie, and were you asking me if it was inside of it? Well, yeah, it is on the inside of it as it's going into the glomerus. Okay. So where are both kidneys located? Retroperitoneal. Approximately 75% of which surface comes in contact with a renal impression of the visceral surface of the liver. Right anterior. Which vascular vessels are arching branches coursing between the medulla and the cortex? Arcuates. The narrowing of which vessel located between the aorta and the SMA should not be mistaken for pathologic.
Left renal vein.
Which one?
Left renal vein.
Left renal artery. Left renal vein. Okay. And what is that pathologic called?
Nephron syndrome.
Okay. Kidney functions, we kind of already talked about. Oh, class is already over?
This is what he's talking about, that part of the question that you just showed right now?
Mhm.
Saying that things are confusing.
Yeah, right here. Don't confuse that right there for pathology. Okay?
Yeah.
Oh, I've got till 11:45. Oh, perfect. Yeah, y'all come back at 12:30. Okay. So the kidneys, they remove waste from our blood. They regulate the blood's fluid and electrolytes contents. Each minute, about 20% of the total cardiac output goes through the renal artery and the left renal artery. 90% of that blood entering the kidney goes through the cortex, and which is where the nephrons are located. Only 10% of the blood that gets to the kidneys keep the kidneys alive. Isn't that amazing? This is what gets me. That 180 liters of blood-derived fluid daily goes through the kidneys. Isn't that amazing? Okay? And it does it 60 times a day.
60 times?
60 times a day. That's amazing to me. So, what is the purpose of the nephrons? They control the blood concentration. They remove water and things that our body doesn't need. It helps regulate the pH, and it removes toxins from our blood. What happens if our pH is wrong in our pools? Anybody know that? Makes us itch.
Oh.
I was on a cruise one time where the pH was off in the water system, and everybody was walking around like this for 3 days.
Wow.
So the process of the nephron, you have the filtration from the glomerulus, you have the reabsorption of the tubular loop of Henle, and you have secretion of the tubular loop of Henle. Okay. Anterior pituitary, the posterior pituitary gland. It sits in your cella turcica of your brain. It's about the size of your thumbnail. The anterior pituitary gland controls the female reproductive system. The posterior controls the kidneys. So what happens is the posterior pituitary gland puts out a hormone. That hormone is considered an antidiuretic. What is a diuretic? Makes you pee. So an antidiuretic, no pee. It keeps you from that water completely going straight through you. And that is called an ADH hormone. Another hormone that it helps, what does ADH do? Is it maintains our body fluid balance, whether we have sweating, diarrhea, low blood pressure, or if I'm bleeding out. Say I'm hemorrhaging out, okay? Aldosterone. Aldosterone helps increase the tubular reabsorption of sodium and helps with the loss of potassium. Now, potassium, a person on dialysis has to pay attention to their potassium, because dialysis cannot remove potassium from the body. So you have to control your potassium by diet. If your potassium gets too high, then that can throw you into cardiac arrest. Okay. Okay. So, but potassium, you have to have it because it promotes the aldosterone production, or the secretion of the aldosterone. So secretion is also controlled by renin-angiotensin. Renin increases with decreased blood pressure. It affects the afferent going into the arterioles, And that's why sometimes if you go to the doctor and you hurried, and you get in there and you have a really high blood pressure, then they make you sit for 15 minutes, then they'll retake it again. If it's still too high, they make you sit another 15 minutes. Or they might do your blood pressure lying down, or they might do your blood pressure standing up. Okay, all of that has to do with the renin secretions. So renin acts as a catalyst for certain plasma proteins, and it helps in the production of angiotensin 1. I'm not gonna ask you any of this, but you need to know that the hormones by the posterior pituitary gland is like it's a closed system. So if you're not having enough aldosterone, then your renin's gonna kick in, and the renin will help with the anti-statins that your body needs. Okay, angiotensin 2, it increases the blood pressure. It helps with the vasoconstrictor of your peripheral arteries. It increases your blood pressure. So if I have low blood pressure, they can give me this to increase my blood pressure. Okay, that's that. For renal function test are your red blood cells, your white blood cells, your creatinine, and your bun. The urinary nitrogen or something. Your urea, nitrogen, creatinine, uric acid. Does it tell me anything else there? Bun is or creatinine is very important for us as imaging professionals, because we do inject contrast into the bodies, and if your creatinine's too high, then it can throw you into renal failure. Oh, here it is. BUN. Didn't tell me what the blood, urea, nitrogen. How much nitrogen is in your blood? Creatinine is abbreviated CR, and uric acid is, they can do it in the UA. Okay, like they can check my urinalysis and they can find out how much uric acid I have. This is blood and this is blood. Red blood cells, it tells us how much red blood cells are being produced in our bone marrow. And the white blood cells, if I have an increase in white blood count, that tells me my body has an infection. Okay, because those little soldiers all go to that area to help fight infection. Hematocrit tells me the amount, the percentage of red blood cells. Lactic acid, that's found in all of your tissues. Your urine pH and your specific gravity. What they can do is they put your urine in a centrifuge, and the debris will go towards the base of the container that it's in, the tube. Urine protein, you never want to have protein in your urine. Protein in your urine is a sign of failure. Albumin is found in our blood, and it's a carrier of hormones. Glucose, you should never have sugar in your blood. Patient preparation, we like to be NPO, nothing by mouth, 8 hours before the exam. Some people will want you to take a post-void, meaning you do your renal exam according to protocol. You do a sagittal and a transverse of the bladder. You send them to the bathroom, and then you measure the residual urine that is left in their bladder after they go to the bathroom. And that's called a post-void. Kidneys, before real time, we did all of our kidneys prone. Because our transducers weren't able to manipulate. And the patients usually couldn't fit between the table and the transducer, so we did them all prone. But now you have real time, and so you turn your patient any way that you can to get the imaging. Just remember, if you do them prone, be sure to flip your image, because you'll move the transducer this way and your image will go that way. So you'll know something's wrong. We never look at a organ just in one plane. We always do it in sagittal, and we always do it in transverse. We've already gone about that. We've already prone. Okay. So measurements will depend on the age, our body habitus, our sex, and how much fluid that we have been able to consume. Just remember, your cortex is always greater than 1 centimeter. This is the correct way that we measure it. Doppler, we always want to, if we do Doppler of the renal artery and vein, we want to make sure that our Doppler angle is less than 60 degrees. We're going to be teaching you Doppler, so, but we need for you to get used to that terminology, so that way when we do teach you, then you'll be able to master that real easily. And those are the different. Pulse Doppler is where we actually take a waveform. Color Doppler is where we just put color on it. There's 2 ways for us to adjust it, and that would be a knob or a scale. Okay, there's 2 ways. And power Doppler does not tell us direction, but the color Doppler will. Red is pulsar transducer, and blue is a waveform transducer. This is for a renal Doppler exam. It's one of the hardest exams that we do, a renal Doppler, and that just tells you a little bit about that. We're gonna go over that later on, but not right now. Okay, it's close enough. Y'all go to lunch. How much more is on this? Congenital, we've already talked about that. Okay, we'll start reviewing tomorrow.